So, you've been diagnosed with cancer and your oncologist insists you need chemotherapy. This video will provide facts regarding chemotherapy to give you more information to determine if this is the right choice for your cancer care. We at Medical Mysteries Investigated are not doctors, and we are not providing medical advice. We are simply providing you with factual information to consider in making a personal decision regarding your health. Let's start investigating. How does chemotherapy kill cancer cells? Let's first define chemotherapy. According to the National Institute of Health, NIH, chemotherapy is a treatment that uses drugs to stop the growth of cancer cells, either by killing the cells or by stopping them from dividing. Chemotherapy is drug therapy. Drugs may be given by mouth, injection, or infusion, or on the skin, depending on the type and stage of cancer being treated. To kill cancer cells, the drugs circulates throughout your body in the bloodstream, so it can treat cancer cells almost anywhere in the body. This is known as systemic treatment. Also, drug therapy kills cells that are in the process of splitting into two new cells. Finally, drug therapy damages cells as they divide. Remember high school biology? Cell division is called mitosis, which means healthy cells going through mitosis are also being killed by these drugs. According to the National Institute of Health, drugs used in treating cancer may cause cancer. The article that NIH references on their website is from 1976. Anti-cancer drugs, which act by alkylation, frequently cause cancer in experimental animals and may be carcinogenic in man. We at Medical Mysteries Investigated are concerned with the fact that the United States Authoritarian Department for National Health is referencing a research paper that is almost 50 years old. With all the money that is invested in cancer every year in the United States, why hasn't there been more research to demonstrate the science, or at least update their website to show the more recent documentation, so we have more recent information in which to make an intelligent decision? Other organizations, like Chemoth, state some chemotherapy agents likewise can cause cancer and are classified as carcinogens. The alkylating agents are also known carcinogens. The interesting fact of these drugs is that many require the hospital staff to wear special personal protective equipment when administering the drugs. This clothing is required to protect the worker from accidentally having a small part of the drug touch them. There are special workplace safety rules for nurses, technicians, and doctors that work with certain platinum agents. We at Medical Mysteries Investigated are concerned by the fact that hospital staff need to wear PPE for an accidental touching of these drugs, which can readily be washed off. However, the patients are internally ingesting a concentrated dose of the drug. How much damage is happening to the much more delicate internal tissue as that of the worker's external tissue? We suggest you get clarification on this matter from the oncologist suggesting chemotherapy for you. The known short-term side effects of drug therapy are nausea, vomiting, diarrhea, hair loss, loss of appetite, fatigue, fever, mouth sores, pain, and easy bruising. The long-term side effects are damage to lung tissue, heart problems, infertility, kidney problems, nerve damage, and risk of getting a second cancer. Don't forget to like this video, subscribe to Medical Mysteries Investigated, and share this video with your friends and family. And we are especially like to hear your comments below if you have gone through chemotherapy and experienced any of these side effects. Ask yourself this: does it make sense to treat cancer with a process known to cause cancer? That is about as intelligent as treating obesity by only eating one supersized fast food hamburger meal a day. In addition to the actual chemotherapy drugs, which usually is 2 or 3 different drugs, are the drugs used to counter the known side effects. This includes drugs to combat nausea, drugs to combat low cell counts, drugs to combat pain. It's a fairly good self-sustaining business model if you think about it. Do your research. There are other methods to destroying cancer cells. Those methods do not include increasing the likelihood of getting secondary cancer or other adverse side effects. One of those methods is boosting the immune system. Another method is changing to a ketogenic eating lifestyle and intermittent fasting. Finally, simple lifestyle changes like not eating foods with red dye number 3, now banned by the FDA, though still allowed in food until 2028. Think about that for a while. Stop using lotions with toxic chemicals. Stop eating processed foods with processed sugars and processed flours are a good starting point. May God continue to bless you in your healing. Medical Mysteries Investigated is grateful for the presence of Robert F. Kennedy Jr. as the leader of the Make America Healthy Again movement. We wish him the best. Thank you for watching.